Hello everyone, my name is Mick Hess, your host for Roving with the Arts here on KSJE 90.9. Please join me every weekday starting at 9 a.m. for the chance to hear full-length, unabridged opera, ballet, symphonic, and chamber music. I'll share news of local concert events that you may be interested in attending, background information about some of the greatest musical compositions ever written. Tune in weekdays 9 to 10 a.m. and Wednesday from 9 to 10:30.
Everyone, I'm Megan Culp, along here with Scott Micklin.
Good morning. It is Tuesday, June 2nd.
June 2nd.
Here we are.
Here we are, rolling through the month of June.
What are we, the week 11, did you say yesterday?
We finished week 11.
We finished week 11.
So we're in week 12.
Oh my goodness.
Uh-huh. You know how I know that, Scott?
How do you know your COVID calendar that hangs in your office?
Yeah, right. The first planner I ever bought was 2020.
Yeah.
And then I'm like,
How's
why did I even buy a planner? Well, I mean, I know because Radio Free Saturday mornings every Saturday.
That's what you're doing. That's right. So now we're on week 11.
We finished week 11.
I'm sorry. Did you just say that to me?
Yeah.
About 30 seconds ago?
Yeah, you got the COVID brain.
Wow. No, I don't. Not yet. But that's all right. Well, exciting. Here we are at week 11. I'm working through this pandemic.
We're in week
12.
Okay.
All right.
Cool.
Thank you.
Okay.
I was going to do the math to say that means we've done, I think,
so many
of these shows, right? At 4 a week.
Because we started the second week, I think.
That's right.
So 11 times 4, 44 shows.
But we started the second week, so it's not 44.
No, I know, but we just finished week 11.
Math is not our strong suit, everybody. That's
Somebody
why we're on the radio.
Math
but anyway,
Teachers of America, call in.
We've done a lot of shows, I believe, is the headline here.
Yeah. Between
the actual number
and 44,
varies
right?
by the math that you're using. Yeah, somewhere between
40 and 44.
Yeah.
Okay.
That's a lot.
I know, and we haven't made our fool of ourselves like as much as you would suspect.
Well, I think the first few minutes of this program might beg to differ, but okay.
We have. I'm just saying, considering.
Holy smokes. But anyway, but today we have a great show.
Yeah, we do.
For those of you that are still with us, because we're going to talk about testing, which is, of course, one of the things we've been talking about all these many weeks about how important it is to find out maybe who is sick, who's asymptomatic, but still maybe spreading, not knowing, and the other types of testing, which is this antibody testing, which is now available in the community.
Right,
so
which
we're
is
going
awesome.
to talk about that. And then we're going to have another guest on later, Tom Yost from the First Tee program.
Yost with the most.
And he may want to try to teach us how to play golf, I think, this morning.
I was at one point very good at golf.
Were you? And then what happened?
District champ.
Wow. And then
life
happened?
Well, no, I just have a penchant for jumping around a lot. Like I would say intellectual and religious convictions are the longest held
Oh,
activities I've ever had.
mentally jumping around, maybe.
Oh my gosh.
Or just jumping around.
So
I'm trying
mu-
to picture you on the golf course jumping around.
Yeah.
Yeah.
So much
like
jumping.
a rabbit or something. Mm-hmm. Okay. Well, there's an image for everybody. Mm-hmm. Anyway, let's go to our
Cool.
phones, and I believe our first guest
It's waiting.
might be on the phone here waiting for us to stop talking to each other. Good morning. You're on KSJE. Hello.
Good morning.
Hi, is this Deborah?
Yes, it is. How are you?
Wonderful. I'm fine, Deborah. Thank you for joining us. This is Deborah Reisinger is how you pronounce your last name, correct?
Yes, it is.
Very good. And Deborah, you are with this American Family Care Urgent Care, AFC Urgent Care, that has recently opened in Farmington. And so thank you for joining us this morning.
Thank you for having me.
You bet. And so so I wanted to bring you on the show, and both Megan and I wanted to bring you on the show to talk a little bit about this testing that you are now offering at AFC Urgent Care, which for folks who don't know is recently opened at the corner of basically Browning Parkway and East Main Street.
Yes.
Okay, wonderful. And so talk to me a little bit about this new urgent care. You've been open for how long?
So we opened on May 8th. It's almost a month. And we are open from 8 a.m. to 8 p.m. 7 days a week. And we see all urgent care, but obviously right now the need is for COVID. And so we are offering the COVID testing, and we do two different types. We do the one that is the SARS-CoV-2 antibodies test, which is a blood draw, and then we do the other one, which is the nasal swab, which is the gold standard for testing if you currently have COVID.
Great. And so if I'm an individual and I'm choosing between these two tests, which one would be, like, what's appropriate for which individual? Is the COVID-19 swab versus the antibody test, who fits for which test?
Well, thank you for that question, because that's something that we answer on a daily basis. And there's a lot of confusion about it. And really the biggest thing is if you're symptomatic, then it's very easy to confuse allergies or flu, common cold symptoms with COVID. And so we automatically rule out flu and strep for you to make sure there's no underlying issues. And then we would do the nasal swab because you're symptomatic or you're displaying some of the symptoms that are common for COVID. And that would be the nasal swab. So that's to see if you actually have the virus currently. The antibodies is actually to detect or report on the presence of any antibodies in your system, meaning past exposure to it, or if you've developed any of the antibodies, which is your defense against it.
Interesting. And that is important to know, right, for many reasons, right?
Yes, absolutely. So one is testing basically if you have it now, and the other one doesn't detect it. It detects if you've had it in the past or you've been exposed to it and developed antibodies.
Understood. And so you have been able to get a pretty good supply of these tests, obviously, to be able to offer to the community like this. And so do you feel like you've got a pretty good supply for the demand that you're seeing?
Oh, yes. We anticipated. We've had a lot of people come here, and it's really wonderful to be able to offer this to the community because hospitals, we're a standalone clinic, so we're not associated with the hospital, although we do refer patients back and forth, obviously. But there is a difference between emergency care at the ER and urgent care. So anything that's acute and less high demand is what you could take care of the urgent care. So we planned on COVID testing, so we don't, because we don't have necessarily a regulation for who can come and you have to be symptomatic. We request, we have a doctor goes out and does a visit at every single encounter. So they're seeing a provider at every single encounter. It's not a drive-through testing. It's actually a drive-up. You go through a triage. You go through a review with a provider, and then you discuss that with the provider which test it is based on what your history is, what we'll run for you. But because we're a standalone clinic and we're seeing patients coming in with concerns, it doesn't necessarily have to be symptomatic in order to be tested. So we have seen a lot of patients. We do have the availability to do about 10,000 on-hand tests for the antibodies, and then for the nasal swab, we're at about 5,000 right now.
So do you ever have people like double dip, so to speak? So say somebody has COVID in my household. Do I need to be tested for like the COVID nasal swab and the antibody test because we know people can be asymptomatic, or does that, we don't double dip yet?
Good question. You said somebody in your house is symptomatic? Or is positive for COVID?
Yes. So if somebody in my house is has already tested positive for COVID, do I do both tests or?
Yeah, that's definitely an availability. The big thing to notice, though, to note on that is that if somebody is positive and they're within the same household, we do still go by the CDC guidelines and recommend that quarantining so that you're away from the family. But that is happening quite often here, and so we do have family members who are, or people within the same household where so-and-so tested positive, and we get tested as well, and they come down and they do get tested, and then they can get their results, because they might not be, like you just said, they might not be feeling symptomatic, but we know that it's over 30% of the population. Some people say it's 60%, but it's over 30% of the population have no symptoms whatsoever, and so they can still be a carrier. So we definitely recommend it if somebody is within the household who's tested positive to come and get tested so that you know, because if you're not feeling symptomatic, then you might go out thinking, oh, well, he has it and he's quarantining, but I'm just going to go to Walmart. Mm-hmm. And then you actually become a carrier, and that's how that works. And so we encourage, if you're within the household, to definitively get tested so that you know, so that you can quarantine as well.
Right. That makes sense. And so these tests are free to the public pretty much, right? I mean, if folks have insurance, they may be covered, but you're also able to offer these things free, correct? With no charge?
Yes. So if you have insurance, part of that Family First Cares Act is to waive all co-pays, and anything that is COVID related would be covered 100% at no cost if you have insurance. If you don't have insurance, we are a designated center, so we're really proud of that, to be able to provide service to people who do not have insurance, so they can come down. And the only requirement from the government for that is that you have to have a photo ID. We have to verify who you are, and then we do verify your social. So your social and your ID is what's necessary, which is identification. So most people are very understanding of that, and they come in and we can definitely do testing. And it's not just a test, because remember, they're seeing a provider, so it is a doctor's visit every single time. And so it's not just COVID, but it could be anything that's related to it. Then we're definitely making sure that the doctors are looking at what those symptoms are, and we have the opportunity to test for other things as well. It's that time of year, people are getting strep, there's other things that are out there, so we don't just go, oh, COVID testing, that's what's included. It's a provider's visit, so they're seeing somebody at each encounter, and if they need to, run blood tests, or they need to do something else, to come in and have them be seen for something different. We do x-rays on site. They're doing all of that at the same time, and that's all covered in their visit if it's medically necessary.
Understood. Well, Deborah, it's great to have you in the community. Welcome to Farmington, American Family Care, Urgent Care. Again, it's at 2930 East Main Street in Farmington, as we show the brochure kind of on the screen there. And as I mentioned, it's kind of right there at the intersection of Browning Parkway and East Main Street in Farmington. And you're doing these tests 7 days a week, and the testing from 9 a.m. to 7 p.m., correct?
Yes, we have a tent outside from 9 to 7, but we are open from 8 to 8 for all visits as well.
Got you. Okay, very good. Well, thank you for joining us this morning, and again, providing this information and the service to the community. We appreciate it.
Thank you so much for having me. Have a wonderful day.
All right, you as well. Thank you so much. That is Deborah Reisinger. She is with American Family Care, Urgent Care, the new urgent care here in Farmington and San Juan County.
Yes.
So,
well, how exciting. So 10,000 antibody tests and 5,000 COVID tests.
Yeah.
What a dramatic improvement from like a month ago.
correct, right?
Yeah.
With these types of tests.
Right. Antibodies wasn't even available.
I don't believe
So-
so. That's
Wow.
exciting,
So good job, guys.
right? There you go.
Whoever's pounding the pavement out there with tests.
Getting these tests. And I know we're going to be talking with the Department of Health, I believe, on tomorrow's show.
Tomorrow.
To talk a little bit about their ramping up of testing. In fact, there was another testing event this morning here at San Juan College this week. It will be again on Thursday here at San Juan College this week, beginning at 7 a.m. The lines were not as big as they were last
I
week.
noticed that.
So,
I noticed that. So I was like, maybe I should pull in. I'm like,
pull in for a test?
yeah.
Oh. Well, there
We
you
did
go.
have a comment
If
that
you didn't,
said that
if
we
you
should
didn't have a
do
show
it.
to do, I would probably say
was gonna
sure,
say,
but you
well,
kind of have something to do. Yeah,
We
what?
do. We had that comment that said that we should get tested like Andrew Cuomo did.
Yes, yes.
So maybe I should have pulled in and then just zoomed you from the parking lot.
There you go. All right. We'll
Which
take that
one of
under,
us is going to submit to a nasal
Yeah.
swab?
We'll take that under advisement. I vote you, but
You would vote me.
I would. You're my favorite co-host, so I would vote you all the time.
How sweet.
Yes.
How sweet.
That's right.
So are we pulling? We're zooming the next guest, right?
We are, and I was going to
Because-
talk about numbers first, and then we
Yes,
could zoom the
right.
next guest, because Zoom is not up and running yet. If the guest
Okay.
is asking you, because I know sometimes he does that.
The guest is not asking me.
Okay, good.
I like how we keep referring to him as just the guest.
It's a mystery guest. It's a surprise,
Yeah.
right?
It's always like Scooby-Doo up in here.
Exactly.
Remove the
exactly.
mask.
That's right. So here we are, again, ksje.com. We are compiling the local numbers. Again, there's a lot of other resources, too. These are from the New Mexico Department of Health, from the Navajo Nation, San Juan County. Again, the San Juan County Office of Emergency Management has tried to be kind of the clearinghouse for reliable information about COVID-19 and our county's response to it. We appreciate their transparency and sharing some of those things, but this is what we have at ksje.com. Again, so the dashboard, we're now at 7,800 cases statewide. In New Mexico, another 113 reported yesterday. And you remember on Sunday there was a delay. And so I think we're catching up now from the labs. San Juan County had 37 new cases yesterday. 6 deaths in New Mexico reported yesterday. 2 of those were in San Juan County, and 35 additional recoveries at 2,888. So those are the numbers at a glance, and then we have the link there to the NewMexicoHealth.org dashboard. You can find out more information from the Department of Health there, and then more details about the statistics there. The Navajo Nation had 131 new cases yesterday. They are now at 248 deaths across the reservation. That was an increase of 2 as of yesterday. And they are reporting 1,920 recoveries on the Navajo Nation. So
Good.
So yeah. So that's
Recovery.
positive.
Yeah.
So we like that. So there you go. So those are the numbers, and again, we keep watching those, and we watch for the numbers on Thursday when we show the ones from the county that compiles them and uses kind of the 7-day average, and it really gives us a better idea of at a glance how things are going, and so I think that's important as well. I did want to point out too, back on the Navajo Nation numbers, when we click on it, and you can see kind of that graph that they have included there. Right there. The biggest area of cases in the service area on the Navajo Nation, I believe I misspoke maybe last week when we showed these and said Kayenta. It's actually Chinle in the center there. You may not be able to see it on the screen, but Chinle has 1,415 cases in that service area on the reservation. Kayenta is at 828, Shiprock at 894, Crown Point at 534, Gallup service area is 922, and then lesser amounts in Fort Defiance, Winslow, and Tuba City. So I just want to take some time to clarify that.
Right.
So there you go. So anyway.
So if you click on that link, it takes you to a more in-depth graph.
Exactly. Right. And we're getting that from the Navajo Nation. So there you go. So I'm going to start Zoom.
Cool.
We'll see if our next guest
Cool.
is ready. Well,
I have some national numbers.
do you?
I do.
All right, then.
According to the Johns Hopkins University COVID-19 dashboard, so we will definitely consider them a reliable source.
Yep.
As of last night, 1,811,360 cases of COVID-19 have been reported in the U.S., which is an increase of 21,188 from yesterday. And 105,165 deaths have been attributed to the virus, which is an increase of 784 from yesterday. The mortality rate among confirmed cases is 5.8%, and that mortality rate is adjusting per, testing protocol. Get a
Right.
more accurate number depending. So.
Gotcha.
And so 17,340,682 tests have been conducted in the United States. In fact, almost 500,000 conducted since yesterday.
Oh,
And 10.5% of those have come back positive. So I know I just threw out a lot of numbers, but I think it's safe to say, just like in our own community, that national testing is taking off and increasing.
right.
So
So that's cool.
that is cool.
So, and that's important, as we've always said and heard from the health folks. The more testing we have, the better we have an idea of where these hotspots are and how to better maybe control it. Because if we have to quarantine people or separate them from their families so they don't infect other people in their immediate vicinity, this is how we know that.
The more you know.
The more you know. Thank you. Appreciate that. Yes.
Knowledge is power.
Exactly. That's what they say. So anyway, our other guest, I think, is
He's waiting.
Is
There he is.
ready. I can see him. He was on the move, and he's still moving around over there. And
He's talking,
He's
but-
talking, but we can't hear him. So, but let's go to our new guest. Now we can hear Thomas Yost. We sure can. Thomas Yost from the First Tee program of San Juan County. Good morning.
Can you hear me?
Yes, sir.
Good morning. Can you hear me?
We can hear you and we can see you. So we're going
good.
out. Oh, we're going
I
outside.
can't see you guys, so
No, but we're here. Don't worry.
that's a good thing.
Yeah, but that's
Okay,
all right.
Good.
Tom is with
I
the first.
apologize.
No problem. Tom's with the First Tee program of San Juan County and is taking us outside. And there we are. And this is your backyard, Tom.
This is my backyard because I don't have internet access on the golf course. My apologies.
Well, we need to talk. Who do I talk to at the county about that?
Mike Stark.
Let me get a hold of
You
Mike
have him
Stark
on the line,
about.
don't you?
We need Wi-Fi at Riverview.
Oh, we've got it at Riverview. I just can't
Oh, okay.
access it out.
I
on the
understand.
golf course.
Oh, gotcha. Okay. Well, anyway, thank you for joining us. This was, I think, Megan's brainstorm to bring you back on the show.
That's
So
right.
I'm going to turn things over to. I don't know why I'm still talking. I should just let you talk to our guest.
Let the woman with Scott talk.
Right?
Okay. Well, no, I brought Tom on because the governor's order has now opened back up golf courses.
Yes.
And we are in a season right now where kids are looking for something to do and parents are looking for positive activities for their kids to engage in. And so I know that First Tee has been waiting patiently for some reopening of golf courses, but I also know that they're trying to be safe in distancing kids and things like that. And so I wanted to hear an update from Tom. It's been a while, probably since week 2 of us doing this.
Yes.
Yes, that was a long time ago. I've gotten grayer and older since then. A year older.
There,
At
see,
least.
it seems like
So-
it. That's true. Well, look at us. But anyway.
Right. So yes, governor has opened up golf courses and laid down sort of the rules of engagement for summer programs with regards to teaching youth camps and stuff like that, and keeping it at a 5-to-1 ratio. So we're sort of still behind the 8 ball a little bit. We're putting together all the guidelines, and we're getting instructions from our parent organization, First Tee, with exactly how we go about doing it effectively and not reinventing any wheels, because it's all new for everybody, right? So right now we're running virtual classes online. So I have uploaded videos and sent access to those participants. We have about 8 to 10 in our first class. They'll take 6 virtual classes with the encouragement of going to places like Civitan or Pinion or Riverview to practice filling out activities and documents online and stuff like that. So it's a nice sort of gradual introduction to what we do. And then we'll start doing very limited programming starting June 15th. Like I said, 5 to a class. It's going to be very small classes and not a lot of opportunities for the community to get involved like they have in the past, just because we don't have the manpower nor the space to congregate hundreds of kids together and be able to do it in a responsible manner. So that's where we are right now.
Okay. But exciting news that you're moving along more than you were last week. So that's, I think, good things. And that's important.
Absolutely.
So,
Absolutely. It's very important.
Yeah.
It's very important. And hopefully, the numbers continue to decrease and things start opening up. And obviously it's going to be a little bit different
sure.
going forward. I don't know if we'll ever go back to where we were before, but, hopefully
right.
it's some sort of normal, and we'll be able to engage kids and impact like we have in the past, just sort of in a different manner. So.
There you go. That's true. So, Tom, talk to me about what you've got set up in your backyard there. It looks like, as I would expect, it's a golfer's paradise, obviously.
Yeah, golfer's paradise.
Been spending most of our lives.
Paradise right here.
Yes. So, and you were going to maybe show us a couple of moves, technique,
Yeah, we'll
something.
show you
I don't know.
technique.
Show us some moves, Tom.
Some
I see you have a
moves.
tennis
Yeah, right.
ball on a T-ball tee. So what's going on here?
That is sort of like a target, because in golf, even if we're hitting into a net, it's always good to have something to aim at and aim for instead of just aiming at the net, just like you go to the driving range. And if you're not aiming at a target, you're not really accomplishing anything. So we have the big ball right there, and I can set my golf ball down and hit golf balls to there, and I can sort of see where the ball comes off of the club face, and if it's left, right, or on target leaving the face. I can't really see where it goes after that, which is bad, but sometimes it's all you got, right?
Right. But that can be helpful, right? That can tell you a lot of things, at least about some of parts of your swing, right?
Right, absolutely. Aim and setup. You can get your lines drawn and get everything aimed to the proper target. That's going to be a big help when you actually got out on the golf course. And then when the golf ball comes off of the club face in the first, 6 feet until it hits the net, you're going to be able to see whether the ball is to the right or the left of your intended starting target. So
okay,
that tells you something.
Right.
Anyway.
Okay. Do you want to demonstrate? Can you kind of show us a little form there of what we're talking about?
Sure. A couple things that I want to talk to you guys about today is, number one, grip, which is the most important thing. Okay, a lot of people's grips are bad. And that's sort of the foundation that you're building your golf swing on. So if you start with a poor foundation, your golf swing really doesn't have a chance. So when we grip it on our non-dominant hand, so my left hand, which is my non-dominant hand to start with here, a lot of people have that grip in the wrong spot. And what I want to talk about is, I don't know if you can see.
We can
I'm
see.
getting phone calls here.
No, we can still see. Well,
Can you still see me?
You're a popular guy, obviously.
They're
but
registering for summer.
we can see
I
you.
know. So you can still see me. Good. Well, I'm staring at a blank screen right now, so that's
okay.
I
We're-
don't know.
We're good.
We see you, so
We see you. We
be
see
careful.
we see the grip.
We see the grip.
Yes. So what I want to talk about is a flat left hand, which is my non-dominant hand, which is the top, and that flat hand matching up to sort of the leading edge of the golf club. What a lot of people do is they take a very strong starting grip here, so the back of their hand doesn't match up to the line of that golf club. So then when I put that club down, you can see how close that golf club is. So when that strong left hand makes impact with that golf ball, the ball is going to go to the left. Okay? So we want to make sure that our grip is good, especially in our left hand. That's going to mean square contact, and that's going to get your ball shooting towards the yellow ball behind you, which is your target. And the second hand, being the right hand, a lot of people put that underneath the club. We call that a taco grip. It is Tuesday, so Taco Tuesday, right? It's like they're holding a taco in their hand. And what that does...
That we can relate to.
I know you got our attention with tacos.
We're like, tacos?
Yeah, tacos.
Where?
There you go. So now, we've got a very strong grip. What happens is the club's closing and twisting a lot, and you can't control where the golf ball is going. So first off, grip. Make sure that you get what we call a neutral grip. We're covering the top thumb and our bottom hands. You can't see it. Our palms are facing one another. and the club face is square to our target, and that's going to at least give you a chance with your golf swing. So grip being the most important thing.
Right.
What
Okay.
I want to talk about second is what I see a lot of people doing out on the golf course. They think hitting the ball up in the air requires some kind of lifting motion. So what they do is they try to help the golf ball up into the air. But as we see, when a golf club comes up, what part of the ball do we hit? We hit the top of the ball. And we hit the top of the ball rolls along the ground. We call them worm burners, and it's no good because we want that golf ball flying in the air. So the big misconception is how does the golf ball get up in the air? It's not by lift. It's caused by backspin. So that club comes in a downward motion, hits down on the golf ball, and the grooves interact with the golf ball, causing backspin up into the air, right?
If you say so,
Now
Tom
we got-
Yost, I mean, you're the expert.
Yeah.
I can only
now
tell you
we
where
got-
my ball just piddles off the tee. It's kind of sad.
Well, I think because you're hitting the top of the ball, Scott, because you're trying to lift it up there. We don't want to lift that ball up there. We want to get backspin so that ball starts spinning up into the air. And then what causes the golf ball to stay up in the air?
Hope and prayers.
Physics?
Hope and prayers.
Physics. Those little dimples. Physics.
Ah,
Absolutely.
Megan.
Drag.
See?
Drag causes that golf ball to stay. So those dimples are very important because as it's spinning, the air is getting inside those dimples and it's causing the golf ball to stay up into the air. Okay? So what you're going to see me do right now is you're going to see me not trying to lift the ball up into the air, but swinging down through the ball. Can you still see me?
Yes.
We see you. Yep.
So good?
Yep.
Holy cow.
Look at that.
Sorry. Technical issues.
No, you're
No,
good.
this
So
is
if
perfect.
It's our radio audience that I'm concerned about, but they'll figure it out.
So I'm not trying to lift this up. If I were trying to lift this up, I would either miss it or hit the top of the ball, okay? But what I want to do is I want to swing down and through so the ball goes up into the air. And if you saw that ball was dead on line with my little yellow contraption in the back there.
Wait, so what, were you supposed to knock that tennis ball off?
That tennis ball is behind.
It's on the other side of the net, Megan.
On the other side of the net.
Radio listeners, the tennis ball is on the other side of the
Yes. There you go. So, gotcha.
So, real quick, grip.
Yep.
Right, grip. And I'm trying to swing more down and through instead of lifting up. Down, through, instead of lifting up. So there's your tip for the day.
There you go.
Down and through instead of trying to lift the golf ball in the air. If you're trying to lift it in the air, you're going to have the Scott Micklin dribble problems off the tee.
Story of my life.
Micklin dribble. That's what we call it on the course.
It's documented.
It's documented as the Mick dribble.
Thank you.
Yeah.
Oh my
So-
God. Where is the show going today?
The Mick dribble.
my
Okay,
goodness.
wait. Okay, so
Okay.
Tom, this was an example of these videos that you're producing, right? So
For the kids.
I did produce. I produced about 40 videos that are on YouTube. Our YouTube San Juan County, the First Tee San Juan County YouTube page. But now what we're doing is we're doing 15 to 20 minute videos that are part of our virtual online classes that no one's able to see unless you sign up for the virtual class. So I'll have 6 videos which not only show basics of putting and chipping and pitching in full swing, but we're out on the golf course and we're showing how to use life skills out on the golf course and core values such as courtesy and responsibility, sportsmanship. Now we can't shake hands anymore and say good game. We've got to come up with different kind of social distancing rules as far as air high fives and air knuckles and
Nice.
that sort of thing.
I love it.
That could work.
So how do I sign up for this class if I'm signing up? Where do I go?
If you go to our website, it is screaming at you on our homepage. It's absolutely the first big slide. It says virtual online classes.
Okay.
Just click on on the Learn More and Register button, and it will what? Back up. Sorry, my wife's out here telling me to back up.
Oh, there you go. Okay.
Sorry,
Yeah.
you're staring at my.
We probably should have said that. Thank you,
well.
Mrs. Yost.
Yes.
So we can
Yeah.
sign up online for the virtual classes, which was an example of what you just did. And then, did you say that virus willing, come June 15th,